I'm Dr. Jennifer Robinson from the University of Iowa. I'm a professor of epidemiology and cardiology and the director of the Prevention Intervention Center. And today I presented results from the ODYSSEY long-term trial. This was a trial in 2,300 high-risk patients or people with heterozygous familial hypercholesterolemia with LDL levels over 70. And in this trial, patients were randomized to either Alirocumab 150 milligrams every 2 weeks or placebo and followed for at least 52 weeks, so a year of follow-up, although the trial is ongoing. And the average follow-up was 65 weeks in the results that I presented today. So the first thing is that the Alirocumab treated patients experienced a 62% reduction in LDL versus placebo. And that was from a mean LDL level of 122, and it lowered the LDL down to about 50, so 120 and 50. Now, LDL was a little high in this study, and it represented a couple things. One is there were a significant number of heterozygous FH patients in there, so their cholesterols were high even though they were on high-intensity statins. But there are also about 45% were on high-intensity statins. The rest were on other doses of statins, but they were the maximally tolerated dose of statin for that patient, and that was documented at study enrollment. About 25% were also on another LDL-lowering therapy. So these were pretty, representative patients in practice, and nonetheless, the LDL reduction was quite significant. We also found in a post-hoc analysis that those who received Alirocumab had a 54% reduction in cardiovascular outcomes. Now this is the outcomes that are being used in the long-term ODYSSEY outcomes trial. And so that was quite a nice statistically significant result that emerged early, over 65 weeks of therapy. So I think what this trial tells us is that the additional LDL lowering from Alirocumab is heading us in the right direction. We are getting the expected reduction in LDL events that we hope for with additional LDL lowering. And it looks like it was a pretty well-tolerated therapy. In the long-term study, it was pretty balanced in terms of adverse effects. The only exception was a numerical excess in neurocognitive, self-reported neurocognitive events. But when you look at all the trials as a whole, there were three other studies reported prior to long-term today, and you add up all those neurocognitive events, they're pretty well balanced between the two treatment groups, and indeed the company has looked at the ODYSSEY development program overall, and it looks like there's no imbalance in any adverse events, including neurocognitive outcomes. So we feel much, everybody's worried about low LDL, but it looks like it doesn't seem to be causing any adverse effects and is actually heading us in the right direction in terms of reducing cardiovascular disease.